So as you've explained, breast augmentation is when the implants are put just behind the breast, but I'm interested to know what actual materials these implants are made of.
Now, implants are made of different materials, and we have a whole range of implants at this hospital, from the standard silicone with a very fine texturing to the very coarse texturing ones, and then to having ones which are covered in a polyurethane coat. And as it turns out, those implants have a 15% better chance of not going hard than the other more conventional implants. So things have moved on. We now have better implants and therefore better outcomes with less risk. And the teardrop shaped ones have a place, but a marginal place in what we do for breast augmentation.
So you've mentioned fat transfer as an option. Why would I choose one as opposed to the other?
Yes, fat transfer is a fairly novel approach, and it's used for those girls that really aren't looking for a massive augmentation. They're not talking about a cup size variance from A to C or D, for example. You're talking about a means of just volumizing it to give you slightly more projection in a certain part of the breast, around the periphery or centrally, or to take up a bit of the slack where it's starting to give way. And it's a really good way of doing it because there's minimal risk, there's high reward.
So obviously the methods used are very different. How long could I expect each one to last? And with the fat transfer, is my body going to break down the fat in time? And maybe the implants, do you think they might need adjusting or replacing in time?
Two little questions there. An implant by and large, we think will last your lifetime. We hope it will, but we don't actually know. Today's implants haven't been around 30, 40, 50 years. But those that have now superseded the implants that were around in the 90s are better than the 90s implants, and we haven't changed those for anything other than they folded or they kinked or they were causing problems, which is very infrequent, I have to say. So there can be material wear and tear and they could rupture, but we don't go into this thinking we'll have to change them in 10 years, which is contrary to what the public think at the present time. So how long an implant will last, we don't know. Fat grafting, we think once it's in there, it's there, so it will behave like a normal fat cell. If you put weight on it, your breast will get larger. If you lose weight, the breast will get smaller. So to some extent, there's a flux that goes through your life, and particularly with pregnancy, if you do go pregnant, your milk glands will swell up and your fat will then be squished to the side and probably disappear. So when you then stop lactating, that fat, we have to encourage it to come back in, and it may not. So perhaps you would need further fat grafting later on.
So obviously cosmetic surgery's come a long way in recent years. How real do breast implants look?
Yeah, it depends what you're after really as a lady, because we see all sorts of different groups, you see. The 18-year-old to 20-year-old, we try and put off surgery until they're slightly more mature regarding their thinking, because usually they think implants equal bigger and bigger equals better, and they're using their contemporaries at school, if you like, who were large busted, who were the talk of the north, so to speak, but actually in real terms they're the ones that are going to want the reduction and the mastopexy later in life. But they're using the popularity of their friends to think big breasts are good news, but they're not, of course. So if you can get them over that immature phase and get them to university, and you know, there are obviously clearly some young women that are in desperate need of it. Young ladies of 18 with absolutely nothing, you know they're not going to do any breast development, and therefore we can help them. But for those that are vaguely immature, or we think are at risk, then we should put them off. So we get to the 20, 21-year-old bracket, and they've thought a little bit more about it, and they've seen their friends at university or college, and by then they really know why they want to do it. And they don't tend to think massive at that stage. They're tending to think of a more sensible breast size. And then if they're thinking in terms of not wanting anybody else to know they've had it done, then we have implants to suit. We have small implants. There are a group of young women, though, that choose to be professionals. They are croupiers, dancers, pole dancers, and their profession is all about how they look. And they can really progress well with the artificial look. Now, we don't like doing that, obviously, because we're forcing something which is very much normal. But on the other hand, it makes a huge difference to them as individuals, and it enhances their careers. And they feel that risk is worth taking. And I actually think that's not a bad thing. There are times when you have to then think in terms of what happens to them when they have their children and want to be made smaller. And I've been pleasantly surprised it's not quite as bad a deal when the implants are taken out. You don't end up with a loose skin syndrome in most instances. If you understand how the body behaves, taking the implants out in a girl with good skin, they can regress and actually look quite nice without needing any further surgery. And these are only put in through small little incisions, remember, so therefore the only legacy would be the scar.
Now I understand I'm going to have to wear a special bra after surgery, but how long until I can wear my own lingerie?
Yeah, the operation is you know, fairly traumatic. It's quite painful, and for those that have broken a bone, it's actually quite painful until you put the bone in a cast or the leg in a cast. And the same principle applies to breast augmentation. If you augment a girl's breast, it's painful. So we put you in a bra, which is what we call a front loader, with like a feeding straps at the front, and it actually locks you in. And in addition, we then put another binder over the top and what we call a stabilizer, which holds the implants into position. And those three things immobilize you. You then, this hospital, you would then be thinking of going home later in the day. So in other words, it's done as a day case. And providing, you know, you're fit and well and healthy and you don't do too much on that first 24 hours, your risks are minimal. But you would carry the risk of bleeding. And bleeding means you have to come back in and go to the operating theatre. So you've got to go carefully for that first 24, 48 hours. So the bra stays on, as do the binder and the stabiliser, and then you come back to the hospital the next day or the day after so the nurses can check out what's going on. And then the whole thing is reduced to leave just the bra only. Now this bra we want to leave then untouched for at least a week. And then you come back and they recheck, the nurses will recheck you to make sure everything's in position, you haven't got a massive bruise, you're not running any risk of infection, that sort of thing. And then the following week, you can then, sorry, at the end of that first week, you can then take your bra off and wash it. And then, without putting yourself back into your bra straight away, just wait for it to dry. And just put that bra back on again. But don't go mad buying bras, because they're about 80 quid each. And one bra will tend to do you for the 6 weeks, if you just be careful with how you apply it. Some people like a second bra, or a sporty type bra, and you're welcome to use it. But remember, you mustn't shuffle these things around too much. We're literally just trying to lock you on. We're not trying to lift you. So from the first 2 weeks to the 4th week after the op, we'll let you do a bit more. We can start doing gentle exercises, but nothing high impact. From 6 weeks onwards, you can do what you like. So with a bra that we're going to give you, we're talking about 6 weeks. With care, you could then use your racy underwear, but be very careful how those underwires fit, because the fuller you are, the harder it is to buy a bra without wires. That wire really has to fit you well. We're not asking it to push up anymore, because you're going to have the look without the push up.
So once you've had the surgery, how long until it's safe to fly?
Well, we look at this in two ways. If you believe everybody that's to do with surgery, they'll say you shouldn't really fly for 6 weeks after an operation. The issues aren't really quite as clear-cut as that, because a lot of my patients are actually airline hostesses, and of course they have to fly within 2 weeks or they lose their jobs. So they're up and about and flying. If you're flying short haul, you're probably okay. If you're going long haul, then it's a difficult answer. I'd probably say between 2 to 6 weeks, you're probably running a little bit more risk. But if you wear flight socks and take a small dose aspirin and that sort of thing as a prophylaxis, you'll probably be okay, providing you don't have gastric upset or you don't have a tendency to bleed or gastric bleed. So you put yourself at risk in other ways by doing that.
Professor Frank, thank you so much for spending time with us today, and I'm sure that you've addressed many of the queries that a lot of us have about these cosmetic procedures. Well, I hope that in the last few minutes I've managed to answer some of your questions about breast augmentation and uplifts and what you should expect from the procedures. If you've got any more questions or wish to see a consultant, call the number on your screen or check out our website for more information.